Following the previous class, we shall have a discussion on another application of optical fiber. This is in the area of medical field. There are two types of surgeries: macrosurgery and microsurgery. And the surgery is just a removal and repair of damaged tissue. Let me brief you on the differences between macrosurgery and microsurgery. Macrosurgery is our traditional surgery. This is a conventional method used for decades. It involves large incision, about 4 to 10 inches. It is also called as open surgery, to have a direct access to the organ or tissue. We can have a direct access to the organ or tissue, a direct visualization and direct handling of tissues, manual handling with the surgical instruments. Of course, they are microsurgical instruments. Definitely, this will cause damage to the surrounding tissues. As a consequence, more bleeding, more pain, more risk of infection, and about the recovery, it has a longer period of recovery. It is in contrast with the microsurgery. Microsurgery is modern surgery. It involves small incision through which a tube, the tube which may be laparoscopic or endoscopic tube, is inserted, and there is no direct access to the organ or tissue. Indirect access, no direct visualization, no direct handling of tissues with hands inside the body. And let us discuss this in detail little later about this indirect access. And because of this little incision, making a little incision, it causes no damage to the surrounding tissues or a little damage, and less bleeding, less pain, and less risk of infection, and a shorter period of recovery. These are the differences between macro and micro surgery. In macro surgery, we have direct access. In microsurgery, we have indirect access. Let us understand what is that indirect access to the organ. It is after the incision, this tube is inserted to the body to the appropriate point. So assume that this tube is inside the body and this end is outside the body. And this tube, about half inch, approximately half inch, and the tube consists of mainly 3 channels. Look at these channels. I have given a flow diagram of the channel. This is the optical fiber channel. This is instrumental channel. This is irrigation channel. And in this case, this tube is inserted, there is no light inside. Inside it is dark. Without light, no visibility is possible. First of all, you have to send light to the site of surgery. The site of surgery at this end. How do you send the light? Through the optical fiber. That is an optical fiber. It will send light from a source outside the body into the site of surgery at this end. In spite of being smaller in size, the size, look at this is of this size, millimeter size. It can send the light of high intensity. It may be a laser as well, from the source to the point of sight. That is the characteristic property of the optical fiber. It contains, of course, thousands of optical fibers, the cable carrying. This is of smaller size, millimeter size. That is the intense, very high intense of light is sending to the site of surgery. And that site of surgery is illuminated with the light. With that illumination, we can take the picture or video picture using the camera fitted at this end of the cable. What kind of camera is that? The camera is micro size camera, and the camera is high definition camera. After capturing the video coverage of the site of surgery where the intense light is illuminated, that convert that image into electronic data. This is how it is programmed. That camera is also programmed to convert the video image into the electronic data, which can pass through a thin conductor in the same cable connected to TV, where we can view the image on the TV monitor. Here TV monitor is there. That is indirect access, indirect visualization, no visualization, no direct visualization. We always see the site of surgery, whatever the activities at the surgery, on the monitor of the TV, which is mainly because of this endoscopic, that is this optical fiber, without which this surgery would not have been existed. That is for the visual observation, indirect observation. And next is, how can we carry out the surgery? We cannot put the hand directly into the site because the size is small. It is half an inch. So there is one more channel. This channel is also in millimeter size, through which we can insert the surgical instrument. What type of surgical instruments they are? They are microsurgical instruments. Here, this end and this end, this is inner end, this is outer end. That microsurgical instruments are specially designed They are long and thin. Long because of they should have a connection between this point and this point, and very thin because it can accommodate only the thin size of the. It is long shaft. That is long and thin shafted. This channel. And the instruments, as you know, of course, we have different types of surgical instruments for cutting, instrument for pricking, instrument for stitching. There are different types of instruments. All of them can be inserted through the instrumental channel only. They are specially designed. There is a special engineering design. The engineering science is also applied over that, specially designed such that there is a handle here at the other end, and the working tip here inside the body at the site of the surgery, and it is provided with a precise movement. The working tip, I have different design, of course. Working tip design are provided with a precise movement, and there is a handle, and this hand is also designed in such a way that by handling at this, here it is operated inside. Here the doctor or surgeon is operating from the outside of the body, and the tip is inside where it is getting operated. That is the kind of design we have the instruments, macrosurgery, and all these are specially designed to perform the intricate procedures. They are specially designed to perform the intricate procedures, very delicate procedures. You are handling at this, and the tip is working at for cutting or any other work or stitching. All it is at this side. So that is the design we have made in this for a surgical instrument, which is inserted through this instrumental channel. And one more channel is there, irrigation channel. What is the irrigation channel? We are pumping water under pressure. What water? The saline and also sterilized water. What for? For washing and removal of the blood and other debris at the site of surgery, and also washing of the lens clogged during the surgery. It is always keep washing with the saline water and keep washing this lens for a clear view on the monitor, on the TV. For this we have the tube that is carrying water from outside to inside. And also there will be a tube to pump out. Pump out means the unwanted debris and blood from the site of surgery out through this channel. It is called as irrigation channel. And through this irrigation channel, sometimes we pass the gas under pressure. The purpose to inflate the interior cavity, for a clear visibility. The gas. What kind of gas you are using? Carbon dioxide usually. Is it safe? The reason, if the tissues absorb carbon dioxide, it will come out through respiration, where the blood carries the carbon dioxide from the tissue to the lungs. That is why carbon dioxide gas is a safe one for this procedure. So this is how all this, the equipment for a visibility, equipment for carrying out operation, Here operation, the hands are working outside and surgery is taking place inside. That kind of design. And these are all what is that micro size or millimeter. Such a way the equipment is made. So this is how design modern surgery. And there are two types of tube. It may be a laparoscopic tube or endoscopic tube. What is laparoscopic tube? Laparoscopic tube is rigid, made of metal. We use this laparoscopic tube for carrying out abdominal surgery of the abdominal organs. What are those abdominal organs? It may be stomach as well, the liver, the abdominal organs, kidney, appendix, and also some intestine, like that. Abdominal organs where the tube is inserted into the abdominal cavity through the side of the belly button. Near the side of the belly button is inserted. This laparoscopic surgery is mainly for the abdominal surgery. And what is a endoscopic tube? Here, in most of the cases, it doesn't require incision. Since we insert this tube to the natural body openings, what are those natural body openings? The mouth, nostrils, they are natural body openings, and the anus, vagina, where we can do the diagnosis and repair of the tissues of the inner lining of these tracts. It may be GIT tract, the esophagus, and the stomach, the interior surface of the stomach, and the inner surface of the esophagus, and the inner surface of the gastrointestinal tract, and also anal channel, like that. We can do all this surgery using endoscopy. It is just insert because it is flexible. We can insert it through this natural opening to the depth where we are supposed to carry out the surgery. Endoscopy. And this endoscopy we can also use in spine surgery, where it requires a small incision because there is no natural opening. Spine surgery is also we are using this for this endoscopy. In the case of endoscopy, spine surgery. So this is all what is that microscopy, the technique. The technique and the design, there is a lot of engineering science. It involves, and most importantly, the skillness with which the hands are working is crucial for a great success of surgery. The skillness, because the hands with which the hands are working, or with which the legs are working, because the leg is connected to, that is, it is connected to these channels, with which, very most important, and the doctor or the surgeon undergo a rigorous training to handle this kind of equipments. That is, for a macroscopic surgery, you should have the background of engineering science in addition to his medical science for a efficient carrying out the procedure like this. Here overall, it is all depending on the optical fiber, where the application of optical fiber plays an important role in this microscopic surgery. It is a modern surgery. It is most important nowadays. Thank you very much.